Everyone, Dr. Jeff here with you today. Heart Stroke Month. Last time I was with you, we talked a little bit about your HDL and your LDL ratios, and we're going to talk today about how to improve those. Now, if you remember back when we talked last week, we talked about your cholesterol and how your VLDLs and your LDLs get taken from your liver and they get sent out to the cells because your cells really need cholesterol to repair themselves and build new cells, and how these VLDLs and LDLs kind of bump their way along your arteries to get to the cells, and little pieces break off, and that forms the plaque, or arteriosclerosis and hardening of the arteries, and how HDL is formed by the liver goes out, and actually it's the garbage man that picks all these things up, returns it back to the liver, so that so it cleans everything up and can be reproduced. So we're going to talk a little bit today about how to increase that HDL-LDL ratios. Well, one way to get your LDLs down, the one way the medical area would go to, is something called a statin drug. So that's your Lipitor, your Zocor, and things like that. And that will help reduce your LDL levels, and it does a good job. But the number one side effect is muscle aches and pains. And I've had lots of patients come in with sore muscles and aches, and it's not until we treat them a little bit we find out that they're on Lipitor and Zocor, and we can't really get them better because it's the medication that's actually causing the muscle aches and pains. So we try and put them on. So your choice is to either go off the Lipitor, which you don't recommend, or you go on coenzyme Q10, which is an enzyme that the body needs to actually help the body relax itself. So you go on Lipitor, generally you have to take something else, like coenzyme Q10, to get rid of the side effects with it. There have been some research into trying to increase your HDL levels, but most of the research in drugs they found that really didn't, it may have increased your HDL levels, but they didn't actually show any decrease in your rate of heart attack or stroke. So they've actually stopped producing any drugs to help increase your HDL levels. But what can you do to help yourself? One thing, if you're a smoker, is stop smoking. Number one cause of heart attack and stroke is smoking. So if you are smoking, think about trying to stop. There's a number of different ways out there now to go about trying to stop. All right. Get your weight down. And I'm not as concerned about your weight as I measure your fat percentage. There's a lot of scales out there now that you can actually step on. It doesn't actually give you your weight, it gives you your fat percentage. And fat percentage is more important. Males are between 16 and 18% would be ideal. Females are between 20 and 22% would be good. So getting your weight down would certainly take some pressure off your arteries and off your heart. As far as cooking is concerned, try and use good oil. So olive oil and coconut oil are your good oils. Your trans fats are bad. So your butter, your canola oil, your safflower oil, those oils you try and avoid, especially if you're frying stuff. So stick with your coconut oil and your olive oil. Alcohol, make everybody happy about alcohol. They found that alcohol actually increases your HDL levels. So I do suggest if you are a female or if you're a male over the age of 65 that 1 drink a day is good for your heart, it's good for your brain, it's good for your arteries. If you're under 65 male, going with 2 drinks a day. Now you have to watch, because with drinks you also get sugar. Sugar is bad for you. It creates inflammation in your tissue, so try and avoid sugar if you can. So one way to do that is try to avoid white breads, white pastas, things like that. Right? Nuts have shown a big area that you can increase your HDL levels. Right? So I actually suggest you have about 2 ounces of nuts a day, whether those are macadamia nuts or pine nuts, any types of nuts. A couple ounces a day will help it. Supplement-wise, looking at calcium citrate, not coral calcium, but calcium citrate, actually will help reduce your HDL, increase your HDL levels. For people who like oatmeal cookies, eating oatmeal for breakfast, things like that, oatmeal is found to be really good at increasing your HDL levels, along with purple vegetables, so cranberry juice and cranberries, grapes, red grapes, purple grapes are really good. Grapefruit has found good success in reducing your LDL levels. And for those that like chocolate, dark chocolate, 2.5 ounces of dark chocolate a day has had good results in increasing your HDL and lowering your LDL levels. So there are lots of different ways you can help yourself and your HDL and your LDL levels. I'm Dr. Jeff. If you have any questions about anything, you can always email me at jgoldsworthy@goldsworthywellness.com. I'm Dr. Jeff. I've got your back.